angle. Biopsy means to take out the lymph node for the purpose of investigation. That is called biopsy. So, while taking the biopsy from the posterior triangle of the neck, if the spinal part of accessory nerve is injured, the girl or the boy cannot combing her or his hairs. That shows if you feel problem in the combing the hairs, that means the spinal part of accessory nerve is injured. Okay, then we come to the next muscle, sternocleidomastoid muscle. Look the diagram. This is the trapezius muscle and this is the sternocleidomastoid muscle. Sternocleidomastoid muscle is having the two parts, sternal part and clavicular part. This sternal part is tendinous. The diagram is very clearly indicates the sternal part is tendon, or this tendon is taking origin from the upper part of the manubrium sterni. Look, and the another part is the clavicular part. So clavicular part is taking origin from the upper surface or medial part of the medial 1/3 part of the clavicle. This clavicular part is passing deep to the sternal part. Look here, like this, and the muscle is inserted on the mastoid process and also the medial part of the superior nuchal line. This is the superior nuchal line. There is the origin of the trapezius and insertion of the sternocleidomastoid. So sternocleidomastoid muscle is inserted at the mastoid process and also on the 1/3 part of the superior nuchal line. Okay. The diagram is not showing properly in the origin part, that is, this is the sternal part and this is the clavicular part. Between the two parts, that is sternal part and clavicular part, there is a space which is not shown in the diagram. That space is called supraclavicular space, and this supraclavicular space is containing the terminal part of the internal jugular vein. That is important when we take the during the surgery. If we do anything, we must keep this thing in mind. Okay. After this, the another part, important part of this muscle is, it is also supplied by spinal part of accessory nerve. Also supplied by spinal part of accessory nerve and receiving the sensory supply from C2 and C3. You have done this muscle? Yes or no? Now no one will speak. Okay. When the muscle is injured or before that, when the muscle of one side is acting, it tilts the head towards the shoulder joint. Listen carefully. When the muscle of one side is acting, it tilts the head towards the close to the shoulder joint. And while tilting the head towards the shoulder joint, what is the position of chin? Chin is moving to opposite side. Okay. That is the action when the muscle of one side is acting. Okay. When the muscle of both sides are acting, both the sternocleidomastoid is acting, that helps in raising from the pillow. When we raise our head from the pillow, both the muscles are acting. And that also, ये position और कब लेते हो काम में? While eating food. Okay. So, when muscle of both the sides are acting, they help in bending the head forward. All right. Now the point is another point. When the spinal part of axillary nerve is paralyzed, the muscle is contracting or spasm of the muscle occurs. Or try to understand. Don't consider here the nerve injury. Sometimes the muscle of one side is contract too much and contraction persists. That is called spasm. That is called spasm. If the spasm of the muscle occurs, the person is unable to move, and that is called wry neck. W-R-Y, wry neck. If you ask, the person came to you in this position. If you ask the patient to tilt, unable, due to the spasm of the muscles. किस साइड की मसल होगी? If person comes like this, the muscle of this side will be spasmed. Opposite side. इस साइड मत बोलना. इस साइड तो tilt हो गई. That means the muscle of this side is normal. If you ask the patient to move, tilt the head towards this side, unable, because this side of muscle is spasmed. That is called wry neck or torticollis. Is it clear? Now come again to the posterior triangle of the neck. The posterior triangle of the neck is having the apex, base, anterior border, posterior border, similar to the other triangles. The anterior border is formed by the posterior border of the sternocleidomastoid muscle. So this is the sternocleidomastoid muscle. So its posterior border, that is this one, is forming its anterior border of the posterior triangle. Posteriorly, by the anterior part of the trapezius muscle. So anterior boundary and posterior boundary is clear. After this, see the apex. The apex is formed by the meeting point of the two muscles at the mastoid process. Look here, this is the apex of the triangle, and apex of the triangle, see, this is the sternocleidomastoid muscle and this is the trapezius muscle. So both the muscles are meeting at the mastoid process, that is forming its apex, and base of the triangle is formed by the middle part of the clavicle. Beside this, both of you stand up. Last row, both of you, both the person speaks. आप भी बाहर आ जाओ. Get up. I will see you after 1 year how much you will laugh and how much you will talk. Get up. I don't understand when the person will serious. Another point, this whole of the triangle is again dividing into two parts by this muscle, that is inferior belly of omohyoid. So inferior belly of omohyoid muscle is dividing this triangle into the upper part and lower part. The upper part is also named as occipital triangle because it is having the occipital artery. That I will show you in another diagram. lower part or lower triangle, that is this one. This is also named as subclavian triangle because it is containing the subclavian artery. So on the basis of presence of artery, we also divide this occipital triangle or the upper triangle, lower triangle or the subclavian triangle. This whole of the triangle is covered. So when you will dissect, initially what you will find is skin, then comes the superficial fascia, then comes the investing layer of deep cervical fascia. All right. So first is superficial fascia. The superficial fascia of posterior triangle is containing the cutaneous nerve of cervical plexus. Cutaneous nerves of cervical plexus. Also having the external jugular vein. Look this diagram. The superficial fascia is containing the cutaneous nerves of cervical plexus, external jugular vein, and also the terminal part of internal jugular vein. You can see now this is the supraclavicular fossa. Okay, and besides this, superficial fascia is also containing the platysma muscle. Is also containing the platysma muscle. So all these structures, they are present in superficial fascia. So while starting the dissection, all these things should be in your mind. See, the cutaneous nerves, they are coming from the cervical plexus, C2, C3, C4, C5. C5 coming in the brachial plexus, C2, C3, C4. I am not using C1. Keep in your mind always C1 cutaneous, no cutaneous nerves of the C1 fibers. No cutaneous branches from C1. C1 is giving the nerve fibers to the suboccipital group of muscles that you will do while the suboccipital triangle. There is no cutaneous branch of C1. This is commonly asked in MCQ. So cutaneous branches from C2, C3, C4, the cutaneous branch of C5 that take part in the brachial plexus. And all these cutaneous branches, they pierce the superficial fascia at the middle of the sternocleidomastoid muscle. This is the sternocleidomastoid muscle, and this is the midpoint of the sternocleidomastoid muscle. So these cutaneous nerves, they come here at the superficial region, just at the middle point of sternocleidomastoid muscles. So when the doctor requires to block the cervical plexus, अरे ध्यान से सुन लो बेवकूफों, why don't you listen carefully? You become doctor. When the anesthetic required to block the cervical plexus, they inject the anesthetic agent at the middle of the sternocleidomastoid muscle. The reason is because the cutaneous nerves are coming of cervical plexus, coming or piercing the superficial fascia, come into the superficial fascia at this point. So the anesthetic agent is given at this point. This is also called nerve point block. Nerve point block. So when you will go in final, they will use the term nerve block. So what is the nerve block? It should be clear in your mind. That to block the cutaneous branches of cervical plexus, or you want to block the cervical plexus, the anesthetic agent is given at this point. Now see the different cases. The lesser occipital nerve C2 ascending upwards along the posterior border of the sternocleidomastoid muscle, reaching at the just below the auricle. Here it is supplying to the posterior part of this mandible region and also give posterior part to the auricle. If we pass a line middle of the auricle to posterior, the upper part is supplied by the C2, the branches of C2, and they also supplying to the upper part of the ear. Then the great auricular nerve, that is root value is C2, C3. This great auricular nerve reaching up to the angle of mandible and come down below the auricle, and here it is dividing, giving the two branches, anterior and posterior. They are supplying to the part of rest of the part of the auricle and also the posterior surface and anterior surface of the auricle and also to the skin of this part. The third is transverse cervical, root value same C2, C3, that is passing over the sternocleidomastoid muscle. See, this is the sternocleidomastoid muscle, they are passing over the sternocleidomastoid muscle and supplying the skin part of anterior part of the scalp here. See the other branches, the supraclavicular nerves, the root value C3, C4. The supraclavicular nerves, they are passing superficial to the clavicle and they are dividing into the anterior, intermediate and posterior. They are supplying here to the part of anterior surface of the thoracic region and also to the part of upper part of the deltoids and anterior part. So these are the different cutaneous branches. You will also see here the terminal part of the external jugular vein, and in the supraclavicular fossa the terminal part of the internal jugular vein. So all these structures, beside this the lymph nodes which are not shown here in the diagram, will also see in the superficial part of the or roof of the posterior triangle of the neck. So roof of the posterior triangle of the neck is, listen, roof of the posterior triangle of the neck, first is the superficial fascia. The superficial fascia containing all these structures. Below this, there is the investing layer of deep cervical fascia. The investing layer of deep cervical fascia is attached anteriorly to the sternocleidomastoid muscle and enclosing the sternocleidomastoid muscle, and posteriorly it is attached to the trapezius muscle. That is investing layer of deep cervical fascia. Then look the floor of the posterior triangle. The floor of posterior triangle of the neck, look here, starting from above. The muscles, they are forming the floor of posterior triangle of the neck. Uppermost is the semispinalis capitis. Below that, splenius capitis and levator scapulae and then scalenus medius. So all these muscles, they are forming the floor of posterior triangle. But one more thing is there. All these muscles which are forming the floor of posterior triangle, they are also covered by another facial sheet, and that is the fascia coming from prevertebral layer, investing layer, which is covering the prevertebral layer. So it is continued and covering this, all these muscles which are forming the floor of posterior triangle. And these facial sheet, the prevertebral layer of the facial sheet covering all the muscles, so it is also named as facial carpet. Is also named as facial carpet. It is just like carpet. Now look the contents of posterior triangle of the neck. First of all, in the occipital triangle. What is the occipital triangle? Upper triangle of posterior triangle of the neck. It is named as occipital triangle, as I told you previously, because it is having the occipital artery. So this is the occipital artery. And below this, look here, it is having the different branches. Lesser occipital nerve, great auricular nerve, transverse cervical nerves, all these are the cutaneous branches. And one more, this is the inferior veli formohead. You can see here, that is the subclavian triangle. So if we see the contents of occipital triangle, in occipital triangle, the contents first is the occipital artery, then the cutaneous branches, and also you will find the lymph nodes, and more important, look here, spinal part of accessory nerve. This spinal part of accessory nerve, it is coming out deep to the sternocleidomastoid muscle and running posteriorly and reaching to the trapezius muscle. Above this, you can see the another muscle. What is that? That is the levator scapulae. So try to understand, the spinal part of accessory nerve is supplying to the sternocleidomastoid muscle and also to the trapezius. That is motor, and the accessory part is through the part of the C2, C3. Another part here, you are seeing here the lymph nodes. So the biopsy is taken by removing this lymph node either from the occipital triangle or from the subclavian triangle, depending upon the situation which you want to examine. All right. Now look the contents of the subclavian triangle. Very important and commonly asked. The question is commonly asked as a short note. What is the subclavian triangle, or what is the supraclavicular triangle? What are its contents? Look the contents of subclavian triangle. It is having the trunk of the brachial plexus. All these yellow color are the trunk of brachial plexus, upper trunk, middle trunk and lower trunk. Lower down, there is present the third part of subclavian artery, and along this there is the subclavian vein, and lastly also the lymph nodes. So all these are the structures present in subclavian triangle, and you can understand now that how much it is important. The commonest importance of this triangle is, sometimes if the patient is having the tuberculosis of cervical vertebrae, listen, if the patient is having tuberculosis of cervical vertebrae, the lymph or the infection resulting into the formation of the fluid or the lymph, that is collected here in the posterior triangle of the neck. But as we know, the posterior triangle of the neck is fully covered by the investing layer of the cervical fascia. The muscles also covered by the facial carpet. So this pus is traveled down. The pus is traveled down along the investing layer of the carotid sheath and the part of the, you have gone through the axillary artery and this part. This axillary artery is also covered by the facial sheath. So along this, the fluid comes down and coming in the axilla. So what happens that person is having the enlarged lymph nodes in the axilla. So whenever there is enlarged lymph nodes of the axilla, think also about the person may have the tuberculosis of the cervical vertebrae. I am not saying that first of all you diagnose about the tuberculosis, but you have to examine the complete part. Think also if the other findings are not there, then lastly you can say that tubercular of cervical vertebrae. So that is reaching like this. See this diagram very clearly, you can understand how the lymph nodes they are present here like this. These are the supraclavicular lymph nodes. So supraclavicular lymph nodes, the biopsy is also taken from supraclavicular lymph nodes or from the lymph nodes which are present along the spinal part of accessory nerve. So the spinal part of accessory nerve can also damage while during the biopsy, and the trunk of the brachial plexus may damage if the biopsy is taken from suprascapular parts. This is the terminal part of the external jugular vein. So by seeing this, the posterior triangle of the neck is very important part, and I wish while doing the dissection you see all these parts. Don't go fast, you have sufficient time. Reflect the skin, starting seeing the superficial fascia. In the superficial fascia you will find the platysma and all this. What is the attachment of platysma? That is taken origin from the, you can say that it is the muscle which is superficial, and it is coming from the part of, what is the muscle here? Pectoralis major. So it is also taking the origin from the part of the pectoralis major and reaching here. It is crossing the posterior triangle of the neck and reaching here the angle of the mandible, also at the chin, and reaching at the angle of the mouth, where it is continued with the risorius muscle. What is the nerve supply of platysma? Cervical branch of facial nerve. Okay. So the students, boys, I am speaking only boys. Okay. While doing the shaving, are you using this muscle or not? So you should be very clear about the anatomy. The daily activities, when you raise your head from the pillow, which muscle is acting? Sternocleidomastoid muscle and trapezius along with the levator scapulae. Okay. And another is combing of the hairs, trapezius. So if you will remember the anatomy like this, you will never forget. And along with this, also remember the part of nerves. What is the nerve supply of it is and what is its action. All right. Look this part. This is the anterior triangle of the neck. One thing, I don't understand whether you know or not. This is the thyroid cartilage. This is the thyroid cartilage, and above this, as you pass, that is the hide bone. Now the anterior triangle of the neck on both the sides, it is formed posteriorly by the sternocleidomastoid muscle. The anterior boundary of the sternocleidomastoid muscle is forming the posterior boundary. Anteriorly, the midline. The midline is passing from chin to the suprasternal notch. Then we divide this into the different. Anterior triangle is, again, there is the subdivisions of the anterior triangle. Look, this one, below this thyroid cartilage and this part, this is the completely having the muscles. So it is named as muscular triangle. That is this one. And look above, this is the suprahyoid, or look here, this is the hyoid bone. This is the hyoid bone, and there is the muscle which is having the two parts. This is superior belly of the superior belly of the hyoid muscle, and this is the inferior belly. So omohyoid muscle is having the two parts, suprahyoid part and infrahyoid part. The inferior belly of omohyoid is forming the dividing the posterior triangle that we had already discussed, and this is the superior belly of omohyoid muscle. And this is the hyoid bone. Look, from the hyoid bone, there is another muscle is attached. This is the digastric muscle. The digastric muscle is having another two parts, anterior belly of the digastric muscle and posterior belly of the digastric muscle. And above this, that is the part of mandible. Now look this part. This is the whole part below the mandible and bounded by the anterior and posterior belly of digastric. This is the digastric triangle. This is the digastric triangle, and this is the hyoid bone, and this is the anterior belly of the digastric, and this is the chin of the mandible, and this is called the submental triangle. Submental triangle, that is this one. And look posteriorly, this anterior part is the muscular triangle. What is this? Sternocleidomastoid muscle, and this is the hyoid bone. This is the superior belly of omohyoid. So this triangle, it is having the carotid arteries and all this. So this is named as carotid triangle. This is named as carotid triangle. So anterior triangle of the neck, while doing the anterior triangle of the neck, we will teach you each one separately. I think that is sufficient. I have seen your condition. The point is this, all these things you can remember only while in dissection hall discuss the things, rather talking about the another part, because there is nothing to talk, neither the ministry or nor movies. I don't understand that what you talk. Nothing is left. So better you decide or discuss the anatomy in the dissection hall, not at your home, neither outside the college. Do the head and neck very carefully, because it will help you for further your medical life. In nerve injury, yes, I forget to tell you one thing applied in the nerve injury. There is the condition myasthenia gravis. Myasthenia gravis is the disorder in which there is gradual weakness of the muscle. There is the gradual weakness of the muscle, and this gradual weakness of the muscle is due to less reduction in the acetylcholine receptors. The gradual weakness of the muscle is resulting due to reduction in acetylcholine receptors at the points. So, due to reduction in the acetylcholine receptor, the person is having the gradual weakness of the muscle. That is called myasthenia gravis. That is called myasthenia gravis. Other injuries we will tell you while teaching you the brain and this. One, I told you the torticollis or the wry neck. In some person, they are not having the wry neck, rather they have the spasm of the muscles frequently. They have the spasm of the muscles frequently. This is called spasmodic torticollis. Spasmodic torticollis. Person is not having the wry neck, but he or she may complain to you, sir, I have frequently spasm of the muscles. Frequently spasm of the muscles. There is no injury of the spinal part of accessory nerve. The spinal part of accessory nerve is compressed, may be compressed due to lymph nodes or maybe another cause. So that will resulting into whenever the spinal part of accessory nerve is pressed, the person is having the spasm. That is called spasmodic torticollis. What is the nerve supply of levator scapulae? Dorsal scapular nerve. And this dorsal scapular nerve is coming from the root of upper trunk. That is supplying to the levator scapulae. And it is also receiving the sensory fibers like the trapezius and the sternocleidomastoids. Here the problem is this, I can't change the another parts. Otherwise I will tell you about the other things, because the diagram is must. There is no blackboard. Now look this part. I hope all are you knowing this. What is the suture? And this is the, look here. This is the frontal, parietal, temporal, occipital is not shown. Look these lines. The red color line which is passing above the external acoustic meatus. Anteriorly it is coming from lower part of the orbit. Look here, this is the orbit and this is the red color line which is passing just below the external the orbit and above the external acoustic meatus. This is called Frankfurt's plane. Frankfurt's plane. This plane is used while doing the surgery or in the relation of the nerves and artery. We will use this term while teaching you the brain and this part. I don't want to see this condition. Am I fool? If you want to sleep, why don't you sleep? Go. such poor conditions, see the another line, the green color line. This is the reed base line, which is just opposite to this. Here it is at the same line and it is crossing the acoustic meter's middle. It is very clearly indicating the coronal suture, the sagittal suture, and this is the lambdoid suture. Different parts of the orbit. The bones, they are forming the floor of the, also the part of the frontal or triangle of this part. Look this part. This is the external occipital protuberance, and these are the superior nuchal line and inferior nuchal line. Look this part. This is the foramen magnum. Here it is the brain lying in the cranial cavity. It is continued downward like this, spinal cord. And this is the vertebrae. This is the different part of the nasal cavity, pharynx, and this. The nasal cavity is showing the part of nasal part of the pharynx. The pharynx is having the different part. In the part of the nasal cavity, that is called nasopharynx. Similarly, behind the oral cavity, oropharynx, and go down like this. This is the scalp. The scalp word is indicating all these. S stand for skin, C stand for connective tissue, L for loose areolar, and P is the pericranium, and this is the dural venous sinuses. Look this part. As I told you, I want to come this part. These are the cutaneous nerves, she can say. The superficial cervical lymph nodes and all these lymph nodes are shown, but all these are the cutaneous branches. So, while going this, see this part, cutaneous supply, also the face. So, that will help you to remember forever. Okay, boys.